In ancient Rome, the blood of fallen gladiators was considered medicine. Spectators would rush forward to drink it, warm from the wounds, believing it carried strength, courage, and cures for ailments like epilepsy. Roman physician Scribonius Largus wrote of people who would step forward and snatch a piece of liver from a gladiator lying gutted in the dust. This wasn't simply superstition, it was early medicine, practiced by the most advanced civilization of its time. The journey from these ancient beliefs to modern transfusion medicine reveals humanity's complex relationship with blood, a substance both feared and revered throughout history. For as long as humans have existed, we've recognized blood's connection to life itself. Ancient Egyptians used blood in healing rituals. Maya priests pierced their tongues and genitals, offering their blood to the gods. The Hebrew Bible in Leviticus states plainly, "The life of the body is in the blood." These intuitive understandings predated any scientific knowledge. Blood was thought to carry not just life, but personality, character, even the soul. When it spilled, life ebbed. When it flowed strongly, vitality returned. This recognition of blood's importance was universal, spanning cultures and millennia. In ancient Egypt and later Rome, blood was considered a potent medicine, especially the blood of the young, strong, or brave. Pliny the Elder, Rome's great natural historian, wrote that epileptics would drink the blood of gladiators as though it were the draught of life. People believed the vitality of these warriors could be transferred through their blood, an early intuitive precursor to the concept of transfusion. Galen of Pergamon, perhaps the most influential physician in history, honed his craft treating wounded gladiators. Born in 129 AD in modern-day Turkey, Galen served as physician to the gladiators in his hometown before eventually becoming personal doctor to Roman emperors. These living anatomical studies allowed Galen insights impossible in a world that forbade human dissection. He observed firsthand how blood flowed from arteries versus veins, how muscles and tendons functioned, and how the body responded to trauma. What he couldn't see, he theorized, sometimes brilliantly, sometimes with errors that would persist for over 1,000 years. Galen expanded on Hippocrates' theory of the four humors: blood, phlegm, yellow bile, and black bile. He believed health depended on their perfect balance. While this theory was incorrect, it dominated Western medicine for nearly 1,500 years. Blood was considered the predominant humor, warm and moist, associated with a sanguine, cheerful temperament. This led to a fascinating contradiction in ancient medicine. Some physicians prescribed consuming blood to gain its vital essence, while others recommended removing it to restore balance. Bloodletting became the standard treatment for countless ailments, from fever to melancholy, a practice that would persist well into the 19th century. As Rome fell and the Middle Ages began, Galen's influence only grew. Bloodletting became the cornerstone of European medicine. By the 13th century, the practice was so common that the Catholic Church prohibited monks and priests from performing it. This edict helped give rise to barber-surgeons, who offered haircuts, tooth extractions, and bloodletting all in one shop. The iconic red and white barber pole we still see today originated as an advertisement, the red representing blood, the white the bandages, and the pole itself the staff patients would grip to make their veins bulge during the procedure. Physicians developed detailed systems dictating when and where to bleed patients. Charts mapped specific veins to treat particular ailments. The amount of blood removed could be substantial, sometimes multiple pints in a single session. Medieval medicine believed that the body contained about 12 times more blood than it actually does, making these dangerous practices seem reasonable. This misguided treatment only hastened the death of America's first president. When George Washington fell ill on December 1799, his physicians drained an estimated 5 to 7 pints of his blood in less than 16 hours, more than half of all his blood. He died shortly thereafter, a victim of medicine's incomplete understanding of blood's role in the body. The first steps towards modern transfusion began with William Harvey's revolutionary discovery of blood circulation in 1628. Before Harvey, Physicians believed blood was constantly being produced and consumed. Harvey proved that blood moved in a continuous circuit, pumped by the heart through arteries and returning through veins. This discovery sparked new experiments. In 1656, Christopher Wren, better known as the architect of St. Paul's Cathedral, used quills and animal bladders to inject substances into dogs' veins. These crude experiments demonstrated that the circulatory system could be used to introduce foreign substances directly into the bloodstream. The first documented successful blood transfusion occurred in February 1665. English physician Richard Lower kept dogs alive by transfusing blood from one animal to another. The procedure was gruesome. Both dogs were tied down, the arteries and veins in their necks opened, and blood transferred through goose quill tubes. 2 years later, Jean-Baptiste Denis, physician to King Louis XIV of France, performed the first animal-to-human transfusion. On June 15, 1667, he transfused about 12 ounces of lamb's blood into a 15-year-old boy suffering from fever. Denis chose lamb's blood because of the animal's gentle disposition. Remarkably, the boy survived. In England, Lower and his colleague Edmund King soon followed with their own human transfusion. The patient was Arthur Koga, described as a man whose brain was a little too warm. Koga was paid 20 shillings to receive sheep's blood. After the procedure, diarist Samuel Pepys met Koga at a dinner party and noted that he spoke very reasonably and very well, though he was cracked a little in his head. However, this promising start soon met tragedy. In December 1667, Denis's fourth patient, a man named Antoine Maury, died after receiving calf's blood. During his transfusion, Maury's pulse skyrocketed. He sweated, cried out, shook violently, and suffered the intense pain in the kidneys. His urine turned black, as if it had been mixed with soup. What Denis observed was the first documented hemolytic transfusion reaction. Without understanding blood compatibility, these early transfusions were essentially a deadly gamble. Though Denis was acquitted when tried for Maury's death, French authorities soon banned transfusion experiments. The Paris Faculty of Medicine declared, "For one transfusion that succeeds, how many might fail?" Similar prohibitions followed across Europe. Blood transfusions, having barely begun, would fade from medical practice for almost 150 years. These early experiments, though crude and often deadly, planted the seeds for future breakthroughs. The questions they raised were profound. Could blood from one being sustain another? Did blood carry qualities beyond its physical properties? Could transferring blood transfer life itself? It would take advances in many fields, anatomy, physiology, chemistry, and surgical technique, before transfusion could become a life-saving therapy rather than a dangerous experiment. By the early 19th century, physicians could finally understand that only human blood could safely be given humans. From drinking gladiators' blood to the sophisticated blood banking system of today, the journey of transfusion medicine reflects humanity's eternal quest to understand, preserve, and extend life. In our next episode, we'll explore how transfusion was reborn in the 19th century, setting the stage for one of medicine's most remarkable achievements. Blood Canvas, the visual pulse of transfusion, is a collaboration between medical illustrator Linda S. Nye and Guy Iannuzzi. Subscribe and join us next time as we continue to explore the art and science of transfusion medicine.